Welcome to the Live Healthy Miami Gardens Facebook Live weekly health and wellness series brought to you by the City of Miami Gardens Live Healthy Miami Gardens, where we bring to you and your family information and resources to help our Miami Gardens community make the healthiest choices possible for ourselves and our families. My name is Katia Harris. I serve as Breastfeeding Touchpoint Program Manager at Jesse Trice Community Health System. I serve as a member of Live Healthy Miami Gardens, and I am your host for today's Breastfeeding Masterclass. Live Healthy Miami Gardens was born from the realization that although health is largely influenced by our individual choices, the conditions in the communities where we live, learn, work, worship, and play are also major contributing factors to the racial and ethnic health disparities faced, as well as our overall ability to make healthier choices. We know that these conditions are systemic, historical, and continue to impact us as communities of color and a whole here and now. Live Healthy Miami Gardens is a community initiative and part of the city's effort to address these conditions and reduce poor health outcomes through the transformation of policies, our environment, and the healthcare system overall, making the city of Miami Gardens a healthier place to be. Joining us today is Deputy Director of Federal Affairs, Andrew Fullerton, with the March of Dimes Advocacy and Government Affairs to discuss the Pump for Nursing Mothers Act. Andrew is a Maryland native and second generation American, has been working for advocacy organizations for about 2 decades now, including work in Congress and in Indiana. Andrew has also worked in healthcare for more than a decade, including on policies and those specifically impacting kidney disease, transplantation, clinical testing, and maternal and infant health. Andrew has helped start three nonprofits to help educate and mentor young professionals in DC and provide continuing education to government relations professionals. And Andrew also asked us in Miami not to hold it against him, which I doubt we would, that he is married to a UF Gator. Thank you for joining us, Andrew. Pleasure to have you today. Could you give us some background your on your organization, the March of Dimes?
Sure. March of Dimes has been around since, I believe, 1938. Um, it was initially started as a organization to combat polio in with a relationship to FDR at that point in time. And it has since then evolved its mission to being one of the world's largest major maternal and infant health organizations. It's our mission to lead the fight for the health of all moms and babies. And it's our goal to do things like end preventable maternal health risks and death. It is a goal to end preventable preterm birth and infant death, and also close the equity gap, which we all know is absolutely terrible right now. And local, recent statistics on some of these issues just highlight that it's gotten worse since COVID started.
Okay. And I know you work with, well, let me first back up. Appreciate all the work that March of Dimes is doing. I know we're close. Well, I'm close, more familiar with Tanisha Avon, who works with March of Dimes down here in Miami. And I know her realm, although with March of Dimes, a little different with yours, more with like the government affairs section. How does that work look, if you don't mind talking about it a little bit in context of the March of Dimes and everything you shared about the mission?
Sure. So what my colleague in Florida does, and what most of my colleagues here at March of Dimes do, are programs to work with the community and support families through things like our NICU Family Support Program, which provides education and information to NICU families, trains hospital staff, so on and so forth. We have a supportive pregnancy care program that brings prenatal care to families and support. We have things like the March for Babies to build a community impact events. And we have like mobile health centers, which go around to different communities, which are in primarily maternal care deserts around the country. Um, what I do is work on changing the policies that impact Americans, both at the federal and state level. Um, so, for example, the case here, the Pump for Nursing Mothers Act, but also, for example, a bill that we're working on reintroducing or introducing this year would affect research and preventive programs around preterm birth. It's called the PREME Act. The Pregnant Workers Fairness Act was a bill that we were very engaged on last Congress, and like Pump passed, I believe in the same bill actually. And it provided additional protections for mothers in the workplace so that they were not did not suffer any repercussions for asking for reasonable benefits, like, I don't know if you're pregnant, a chair, or not standing on your feet, or having more bathroom breaks, things like that at your workplace.
Okay, awesome. And let's talk about a little bit, not a little bit, that's why we're here today. The pump back, or that's the acronym for Providing Urgent Maternal Protections for Nursing Mothers Act. Could you tell us a little bit more about what that is or what that entails? I'm myself still trying to learn a little bit more about it, so
Yeah.
I'm glad you're here to let us know a little bit about it.
Yeah, there are a number of really great resources provided by any number of organizations, and I believe several will be shared during the course of this presentation. But what the Pump for Nursing Mothers Act is it builds upon previous protections that were passed in 2010 as part of the Break Time for Nursing Mothers law. Um, and what this did was it provided additional protections for 9 million women who were not covered by that previous law. Specifically, it requires employers to provide a reasonable break time and a private non-bathroom space for breastfeeding employees to pump during the workday. It makes it possible for employees to file a lawsuit to seek remedies in the event their employer fails to comply with the law. It clarifies that pumping time must be paid if an employee is not completely removed from duty. Um, that this benefit lasts for a full year after birth, and that it does, with some limited exceptions, impact, or cover all employers um, who are, and but if your employer has fewer than 50 employees, one of the exceptions is that they have something exemption if it would cause undue hardship for the employer, that can provide some space for them. However, of course, we hope that they'll still work with the employee to provide as much protection as possible. Um, so the one major exception to this rule is that airline crew, which are the flight attendants and pilots, do remain exempt from these provisions, unfortunately. Um, but pretty much every other person should be covered at this point by the time the bill goes into effect, which I believe will be happening in 3 days for most employees.
You said in 3 days?
I believe it's 3 days. I believe April
Oh,
28th. Railroad and bus companies have 3 years to implement the law, but
mhm.
for most people, the Pump Act, I believe, is implemented in 3 days by law.
Okay, beautiful. So although it's passed, the full implementation hasn't officially
Yeah.
started. Okay, and I think that's one of the things. Among the other things I'm still trying to wrap my head around. I'm glad you're here to explain a little bit about it. Even just the idea of being able to sue or file a lawsuit for if your employer is non-compliant or refuse to comply, which kind of somewhat blows my mind that we had a law in place, but it sounds like there was no consequence or accountability if it wasn't upheld.
Mhm.
So what is let me back up. So what can employers do to ensure that um, they are in compliance, not only with the break time for nursing mothers provision,
Mhm.
if applicable to them, but also this the Pump Act, the expansions that come along with the Pump Act.
Sure. I think the three biggest things that employers can do, um, and I also will discuss what employees can do,
Mhm.
even if they're not using the benefit themselves. So, for all those people listening here, the first thing is they can go on the U.S. Department of Labor website, and State Department of Labor's probably should have information on as well, um, to find information and guidance on both the Pump Act as well as the Break Time for Nursing Mothers webpage. Um, so there is a webpage on this which has resources for employers as well as other educational resources. Um, the Office for Women's Health hosts supporting nursing moms at work the website, sorry, which has searchable resources featuring examples of time and space solutions from businesses across the country, which I think would be very useful for both employees and employers to look through. And um, reaching out to other nonprofits and other agencies at the state level, for example, just not just federal, for additional resources to help advise both employees and employers. Um, but as I mentioned, there are things that employees can do as well, which includes, even if you're not going to use this benefit yourself, it is taking some of the resources that are going to be shared through this program, or the resources I mentioned through the Department of Labor and the Office on Women's Health, and share those with your HR departments at your office, just to make sure that they're aware of this new benefit for lactating women.
All right. And these resources are being shared in the chat as we speak. And again, some of these, some organizations and agencies may have the existing break time for mothers policy or workplace policy that's in compliance of the break time for nursing mothers provision. So it's also ensuring if either that is in place, or that whatever is applicable in the new bill with the Pump Act, making sure that's in place. And again, your employer is aware. Is there anything that the greater community, including, and I'm coming from, a healthcare system, including healthcare systems, can do to ensure that families are properly supported by and sufficiently benefiting from these laws?
I think the biggest thing to do is to um, reach out to people in your networks, whether you're a health network or whether you're an individual, to let people know that this exists. I think the biggest problem, no matter what the benefit is, that when they're new, is awareness. Making sure that if you have a friend who is pregnant or who just gave birth, or gave birth a few months ago, even, um, that they're aware that this benefit exists, because I'm willing to guarantee that many people have not heard about this new benefit, this new law, and um, the best way is to build awareness through personal outreach. I don't know if you belong to a social group, that at your local community center or at your apartment, or if you belong to a Kiwanis club or a Lions club or a vet, uh, Veterans of Foreign Wars,
Mhm.
whatever the group may be. There are always opportunities out there to post something on a bulletin board, or post something, post a tweet at that organization, um, to email someone and say, hey, do you mind if I take 5 minutes at a meeting to discuss this? I think it's really important for people who may need this benefit to be aware of it.
All right, and I appreciate you sharing that. So, I know in Miami, we have the Consortium for a Healthier Miami-Dade, where we have the Children's Issues Committee and the Healthy Baby Task Force, where we do talk about these and other maternal child health and breastfeeding adjacent topics.
Yeah.
And I'm grateful for our community partners that do speak on this and other related issues and really mobilize the agencies and individuals. I don't want to like reduce just the agencies, but the bodies that are there, including March of Dimes, to ensure that our communities and our other partners are informed about not only these changes, but then our responsibilities as advocates, as professionals, as families. Um, what so I know March of Dimes is doing work or has done work in this to ensure that that this bill does come to fruition. Can you tell me a little bit more about what March of Dimes is doing? I guess it's a little bit to talk about what's doing in the Miami-Dade County community because you're also, but I guess what activities that families can look forward to in the year
Sure.
or where we
I
can
mean, I
find
can I can talk a little bit about some of the stuff we've been doing
it. Okay.
through the course of the year, and a little bit about some of the activities that we're going to be doing. Though, again, I thank you for my knowledge of this area of March of Dimes is a little more limited because it's not what I directly interface with
Yeah, and
on
we're
a
hoping
daily
to have Tanisha
basis.
on in the
Yeah.
future anyway. I'm grateful for you being
Um,
with us today.
but March of Dimes has a lot of really fantastic local programming, and it differs a little bit market to market. But in the last month, for example, Black Maternal Health Week, um, we did a series of events on through our collective impact program. For example, in Atlanta, Georgia, we hosted some free pop-up education events at grocery stores and open air markets. Um, in Oklahoma, we participated in the Links Day at the Capitol, and trying to educate people there about both attendees and others um, about the need for awareness of the issues facing moms and babies and what resources exist. Um, I know some colleagues of mine participated in exhibiting at two maternal infant health conferences as well. We participated in a local screening of a movie called Birthing Justice, which is coming out, if it hasn't already, soon, on Black maternal health. Um, we participated in a kickoff of Black maternal health in Harris County, Texas, at their public health um, conference. Um, and of course, we did a lot to try to raise awareness through media and other avenues about the issues being faced by mothers, particularly African American mothers and Native American mothers in this country, um, and the worsening rates of mortality and morbidity that both moms and babies are facing in this country. So, um, there's going to be a lot of similar programs coming up. We also actually have, I think today, for example, in Texas, a March for Change, which is something in my wheelhouse. It's an advocacy day in Texas. We have them in any number of states. I think there's 20 this year. We did one with Congress a few weeks ago, where people can come to their state capital virtually or in person, or in this case, in the case of one here, the federal capital, and educate lawmakers and their staff on maternal infant health policy and the state of maternal infant health in this country or in their state, um, how they can fix these problems, how they have a role in addressing the maternal health and infant health in this country. There are still a couple forthcoming. I don't remember which states off the top of my head, unfortunately. We also have March for Babies going on throughout this month and I think in the next. But we'll have a lot of similar programs to what I've mentioned earlier just a moment ago, as well as the education events that we do at NICUs and other support programs throughout the year.
Okay. And to find more information about what's going on locally or just throughout, the website to marchofdimes.org is in the ticker. as well as Andrew Fullman's contact email or email address.
Yeah.
Um, so we could use that link to for families to access March of Dime resources and agencies to get involved if they want to. Correct?
Yeah, you can. There's resources on our website. You can contact me for additional resources as well. Um, so you
Okay.
know, one of the other things I figured it might be worthwhile mentioning, um, again, to highlight this is a particular need for people who might need this benefit to think ahead and educate their employers before they need the benefit, just in case their HR teams and their bosses don't know of it. Um, we all, well, most of us know just how challenging it can be to return to work after having a child. Like, I unfortunately don't have kids yet, but I have a lot of friends who have had to return to work, as well as colleagues. People on this call probably have knowledge of this. It can be challenging, but particularly if you're breastfeeding or pumping. And a lot of people don't necessarily know that it takes 15 to 20 minutes per session and you need multiple sessions per day, or um, that you a bathroom is not a clean place to be doing this. It might seem logical to you, but not everyone's always logical. So taking some time ahead of your need for this benefit to educate your employers, to express your needs, um, to work with them to find solutions that work for both of you is really important. This is not something you should just walk in one day and say, "I need these things," because employers, just like anyone else, need time to prepare to
Hmm.
provide these benefits. Um,
That's true.
and the other thing I want to mention really quickly is, in similar line to this bill, is something called the Pregnant Workers Fairness Act, which I briefly mentioned earlier, which is another new benefit, which requires employers to make reasonable accommodations to employees who are pregnant or lactating. Um, and one of these things is to make reasonable accommodations to your workspace, to your job duties and schedule, to meet your needs as a pregnant or lactating mother. And that goes into effect on June 27th, and affects all employers of 15 or more employees. So, for example, um, if you work in somewhere that might have pesticides, smoke, heavy metals, toxins. Um, that is something that you shouldn't be around as necessarily as a pregnant or lactating mother. So either arranging for certain protections for you, or to give you a job that removes you from those risks to your child or to your breast milk. Or I don't know if anyone is involved in, let's say, law enforcement or security. Wearing a bulletproof vest, it can be very constraining, and that can have repercussions on, from what I've read, on milk supply, for example, or risk of infection. Um, so, temporary reassignment to something that doesn't require you to wear a vest. Or if you travel a lot for work, helping you as an employee arrange for a slightly longer layover so that you can, let's say, pump somewhere while you're traveling, or um, to provide private spaces on the road or wherever you're going to be at a conference or for work. Um, Things like that. I think those are very important. And the example I used earlier, of course, is a chair, break times to use the bathroom, things like that, which employers may not necessarily give you prior to that law, which is the reason why we have it, unfortunately.
Yeah.
Um,
Okay. And I think I'm gonna have some offline questions about
yeah,
that one. Just like uh I just yeah, I
yeah,
want to understand a little more about this law because I love the idea of protecting the pregnant and breastfeeding and lactating moms. But I do have questions about ensuring that they're protected and not in the sense of not being discriminated against or being denied positions because um, of of the conditions as a pregnant or lactating mom.
Yeah.
But again, I'm glad we're sharing that, but I do
Yeah.
have some questions about that. And I do appreciate you sharing some information about this. I hope to have you on again, hopefully, as we as the Pregnant Workers Fairness Act roll out, we can get some more
Yeah.
insight about that. And again, how our families can be protected, and as well as Tanisha Appen. I know this is not going to be the last time we have Marcha Dimes on our live. And I know you gave a lot of final thoughts, several call to actions for our families as employees as well as our employers. But I do want to give you the opportunity. Are there any other final thoughts or call to actions you would like to share before we close out?
Definitely check state laws too, because I know Florida doesn't have, I don't think has any specific protections um, beyond the federal. But if you are listening from another state, there are other state laws around the country that do offer additional protections or other variety protections. So keep an eye on those as well. I think there was a link shared earlier that to one site that does offer insight into those. Um, Obviously, we'd love for you to become an advocate with March of Dimes to help us continue to change these laws to better protect moms and babies.
Mhm.
Go to our website and sign up to become an advocate. Um, or email me and I will make sure to link you to the right places. Um, and remember, we're a community here, and as I said earlier, we really need to support each other. So even if you don't need these benefits, if you can help educate your employer, if you can help educate others, you are really helping out other future moms. Um, and that is so important. I cannot say that enough. So I think that is pretty much everything I wanted to close up with.
All right, and thank you again, Andrew, for joining us. Those who are joining live, or if you're joining after we close out, whether it's some hours after, the week after, a month after, please share in the chat what was your takeaway from today's discussion. Share your thoughts in the comments. Uh, share it with any breastfeeding, lactating, pregnant families who you think may benefit from today's live. Also, let us know what breastfeeding or adjacent topics that you'd like to hear us talk about, or guests that you'd like to see join us in future breastfeeding masterclasses. Again, we will have Martha Downs on again. The resources that Andrew shared today, they are in the comment section. Also, join us for our in-person and virtual breastfeeding cafe support groups hosted by Jesse Trice and Miami Dade Wick. We're actually hosting one this evening at 5:30 p.m. at our Jesse Trice Barbara Jordan Center in Miami Gardens, and this Friday at our new 11 a.m. time at our Jesse Trice Frederica Wilson Juanita Mann Center. We also have virtual options. Please check out our link tree at JT for Jesse Trice, JT Breastfeeding for support group registration and information on other family centered breastfeeding events and lactation resources. I think we have a link for any March Dawn resources. If not, hopefully I beat you to the punch. By the time you access the link, we'll have some more links for different March Dimes activities or resources that are available. And follow Live Healthy Miami Gardens here on Facebook and YouTube, where we go live with our weekly wellness series every Tuesday at 3 p.m., including our breastfeeding masterclass every fourth Tuesday at the same time. We're also on Instagram, Twitter, maybe TikTok, but I'm not sure, and at livehealthymiamigardens.com, offering more health content and resources. Thank you for tuning in, joining live or viewing after. Again, Andrew, thank you again, and have a great rest of your day, week, and live healthy.
Thank you.
Thank you.